Okay, these now are the chords. All right, so these would be the trunks, the divisions, the chords, because these are rootlets. Okay, so these are the chords. So this is my arm like this. So this is the medial side, so that's medial chord. This is the lateral side, lateral chord. This is in the back, posterior chord. Now what you got to put in your head is this. These are the divisions. They go anterior and posterior, okay? Because this thing's running superior and inferior. Now it's going to go anterior to posterior. So these divisions become the anterior posterior divisions. Anything in the front of the arm, which would mean musculocutaneous, ulnar, median, have to derive from the anterior divisions only. Anything in the back of the arm, such as radial and the axillary, have to only derive from posterior divisions. So they will split themselves up as we get in here. Okay? So this guy here is the most medial, so this most likely is going to continue on as the ulnar. This will continue on as radius. This will continue on as median. Now coming off this median, as we get down to form the M, so you'd have this continuing here, and this continuing here. Okay? Another branch would come off here with it, and that would become your musculocutaneous, hence making an M. Okay? Continuing back here would be radial. Before it would get beyond this point here, axillary would trek up this way to go into the armpit. So if you visualize it, it kind of makes some sense to you. Out here, these things here look like chains. That's the sympathetic chain gang or the sympathetic ganglion.
These guys right here?
These guys right here.
Okay.
When you see the cervical spine don't have any, so this becomes what they call stellate ganglions, like satellite ganglions. And when someone's got chronic pain or a reflex sympathetic dystrophy in an arm or into the face, they'll literally go in, and this one right here, they'll destroy it. They'll shoot a saline solution into it and destroy that it doesn't work anymore to get rid of the chronic pain in someone's arm. And so that's different things they would do. But we're going to learn sympathetic comes thoracolumbar. So if you're seeing something that has a true sympathetic ganglion, you're going to be in the thoracic region of the body. That's where it's going to originate at. So there they are. These little white lines in between the ribs, intercostal nerves. Then we come way down here, right? So way down here, then this is my femoral nerve. The big fat one on each side is sciatic nerve. And the little skinny one on each side here, coming out right there, obturator nerve, because that'd be going to the obturator foramen. That's all you need to know on there.
Can you send me that on my phone? Like, shut off?
And that's the
Cone.
okay, and this is the bright one again.
The right one is the phylum terminalis.
Okay.
Do you matter?
Great. And the
So now what happens in the dural area from L2 to S2? I form a new space called the what? L2, so I'm ending around roughly L1. L1 would be right here. So L1, inferior aspect of L1. So anything I go down in here, I can't hit the spinal cord. Correct? So looking at it that way, it makes sense.
in the dual.
The dual lines of the spinal cord is the anterior funiculum.
Oh, okay.
The funiculus
In the middle, and these are what again?
spinal cord.
It's just a chorus now. Okay.
You know what I mean?